Hello and welcome to another video. My name is Dr. Sil. I'm a junior doctor working in Sydney, Australia, and in my free time, I really enjoy making videos about mental health and wellness. Today, we are talking about schizophrenia. Now, schizophrenia is an incredibly debilitating condition if left untreated. It affects every aspect of someone's life. In this video, we're going to talk about how it's diagnosed, what we think might be going on, because we don't actually know the exact cause or the etiology, but what we think might be going on. And finally, we'll talk about the management options for someone who has it. So if you or someone you know has been diagnosed with schizophrenia or a psychotic illness, then this is a very important video for you guys to listen to. So let's begin. I guess to simplify, if we wanted to describe what schizophrenia is, it's essentially chronic psychosis. And you need to then understand what psychosis is. Now, when we talk about psychosis, we often describe it in terms of two sets of symptoms. We talk about the positive symptoms, and these are things like hallucinations and delusions, as well as disturbances in thought. And we talk about the negative symptoms, okay? Not necessarily that you're feeling down or negative, but the absence of thought and motivation. And so we'll talk about both groups of symptoms. And I guess I just want to make a quick point that that's what these things are. They're symptoms. So schizophrenia is a syndrome, which means it's a constellation of symptoms. It's not a perfect diagnosis of a disease because we don't know the exact cause. So it's just the label we give to people who have a group of symptoms. And as we go into the future and research improves, we will probably find out that schizophrenia is a group of different diseases, each with maybe slightly different causes and treatments. But right now, because the brain is so complicated, we just don't understand exactly what causes all the different types of schizophrenia. So let's talk about these symptoms in more depth now. So the positive symptoms. So the first is they're delusions, okay? And we use delusions all the time colloquially. Oh, you're delusional, you don't know what you're talking about, that kind of thing. Look, delusions are a psychiatric term and they mean a very specific thing. They mean a fixed and false belief that is inconsistent with someone's background, okay? So if someone believes that the CIA are tracking them, or that their dad is a robot that's trying to murder them, that would be a type of delusion. It's very unlikely the CIA are tracking them. It's false. It's very unlikely that the dad is a robot. That's probably false as well. And I guess delusions come in many different flavors and forms, and what I've just described are paranoid or persecutory delusions. Paranoid is more when you think people are following you or out to get you. Persecutory might be that people are trying to harm you. Another common form of delusion you see in schizophrenia is delusions of reference. So that is when people see or believe that things are sending them personalized messages. So if you're watching TV, maybe they think the ads are personally sending them a message. Maybe they think that number plates or signs on the street are sending them personal messages. That's the delusion of reference. So that's a pretty good summary for the delusions. Now for the hallucinations. Now hallucinations are false perceptions. Right now you are looking and listening to me. That is what you perceive. Okay, those are the sensations of vision and of sound that you're getting from YouTube right now. But if you are getting perceptions that aren't coming from external stimuli like this video, but internal stimuli like in your mind, if you hear voices, that is a hallucination. So someone with an auditory hallucination, which is the hallucination most commonly associated with psychosis, or at least schizophrenia, they would hear voice the same way you're hearing it, but it would be internally generated in their mind, but it would sound like it's coming from outside. Sometimes it also sounds like it comes from inside. So they can localize it, and sometimes when you're talking to them, they might look away to where they think someone is talking to them, but it's actually one of their voices. And the most common form of hallucination with schizophrenia is auditory, as I said. So you can have hallucinations of other senses, things like taste, smell, and of course visual hallucinations, but they're usually other things. With schizophrenia, it's most commonly auditory. The content's really important with auditory hallucinations, guys. So if you have voices that are just commenting on what you're doing, picking up the phone, looking at this remote, picking up headphones. They're just commenting on the kind of things that you're doing. That's very different to voices that are telling you what to do, like throw the phone at someone. So you need to investigate the content of the hallucinations. They can also be very derogatory. They can also be awful, like really mean things. And it's just like devastating to hear the stories of young people, because schizophrenia, normally comes out in early 20s-ish age. And that you just hear what their voices are telling them all the time, and it just ruins these people's lives, because you can't apply for a job when you're hearing voices telling you that you're a failure and all these other sorts of awful things. And really, these auditory and visual hallucinations are the positive symptoms that are most commonly portrayed, like that media used to portray schizophrenia most commonly. So when you think of like A Beautiful Mind with, what's that guy's name? Russell Crowe, that's it. So he portrays John Nash, a famous mathematician who had schizophrenia and thought he was being followed by the CIA and other things. So that's kind of a pretty classical portrayal of schizophrenia. But, there's other kind of positive symptoms that aren't commonly portrayed, and that's things like cognitive symptoms, so problems in thought. So to describe what they are, basically, when you are listening to me speak, you can make an inference into how I'm thinking. You can obviously tell that I'm thinking in a coherent and logical manner. Every thought I have follows the previous thought logically. And when people have cognitive symptoms or are thought disordered, when you're listening to them speak, you find it very difficult to follow the flow of their logic. And often you can't follow what they're saying. So the best way to kind of diagnose someone as thought disordered is if you can't follow what they're saying. You just feel like, wait, why are you now talking about this? Wait, what does that have to do with that? That kind of thing. It's really hard to give a good example of someone who's thought disordered, a string of words. I won't even try, but that's another symptom of the positive symptoms in schizophrenia. Now let's talk about the negative symptoms. Right now, when you're looking at me speak, you can tell that I'm using all my muscles of facial expression, that I'm euthymic, that's my affect, that's what I look like at this present point of time. And you can tell I'm making a video, I'm motivated to do things. That's quite normal to have motivation, to have facial expressions, to speak spontaneously like I am. With negative symptoms, it's very different. The negative symptoms are not very well, you don't see it in media very often, but these are people who are absent of many things. So they're absent of motivation, so they do not feel like doing things. And it's not because they're lazy, it's because they have a biological barrier to initiating things or feeling motivated to achieve goals. So they could sit in a chair and stare at a wall all day, I kid you not. So it's extremely debilitating. They also have a flattening of affect. So how I was saying how I'm using my eyebrows when I'm speaking and yada, yada, yada. People who have negative symptoms, their affect is flat. They don't have reaction in how they're speaking. They also often have monotonous voices. They don't have this kind of variability of tone that I'm using right now. So that's the motivation, the affect. Social withdrawal, that's one of the earliest signs actually. So they don't form deep connections. They might be superficially engaged, but quite guarded when you ask further questions, and they just want to be left alone. And also thought blocked, or poverty of thought, I should say. And that's when they give very short, brief answers to any question. Yes, no, and I don't know are the three kind of things you'll hear most commonly. And they might even have delay in responding to your questions while their brain is kind of processing and then delivering an answer. They might even have thought blocking, where they start speaking and then continuing to speak because their brain takes breaks. And sometimes they lose their train of thought because of that. Now let's talk about the etiology, the cause. We don't know, but we know a couple of things. We know that it's a 1 in 100 incidence, so 1% risk across the world, okay? That tells you that it's very genetic. It's not like different social situations bring out different levels of schizophrenia. Everyone across the world has a 1% risk of getting it. So there are genetic kind of baselines. But we know that you can you can have very high genetic risk, like have first degree relatives that have it, but not develop it. So we also know that there are social triggers for it. And so with a lot of things in psychiatry, you have a genetic risk factor that's triggered or by something socially or developmentally. So in terms of what we do know that people with schizophrenia are almost certainly have levels of dopamine that are too high. It's certainly not the only thing that's wrong in the brain, but the level of dopamine is just too high. And that's simplified, but we know it because when we give drugs that essentially effectively decrease dopamine's actions, you get a resolution of those symptoms, especially the positive symptoms. And also when you give people drugs that increase dopamine too high that don't have schizophrenia, they develop schizophrenia-like symptoms, so psychosis. That being said, the most effective medication for treating schizophrenia, which is called clozapine, it's not the first medication you try because of its side effects, so they try other ones first. That has effects on lots of other neurotransmitters like glutamate, serotonin, and GABA, and so there are other transmitters that are implicated in the cause of schizophrenia. I guess the short answer is that it's really, really complicated. We don't know exactly what's going wrong, but it involves neurotransmitters. Now, what to do if you have schizophrenia or if someone you know has schizophrenia? Look, in all of psychiatry, when you address the treatment of illness, you consider three factors. You consider the biological treatments, so that's medications. You consider the psychological treatments, so that's talking therapies. And then you consider the social aspect of management, which is having strong social supports and relationships and enough money to survive off of, and that kind of thing. With many conditions, with some conditions, you don't always need medications in psychiatry. So psychotherapy and good social supports can actually be very therapeutic for a lot of conditions in psychiatry. But when it comes to psychosis, there are no talking therapies that cure psychosis. You really need biological therapies almost all the time when you have psychosis or schizophrenia. And I know that's a hard thing to swallow because the meds aren't great. They have a lot of side effects. They're sedating. They can cause hypersalivation. They have side effects, but the side effects are not worse than the psychosis because you can do awful things when you're in a psychotic episode. So the medications of choice are a class of medications called antipsychotics. It's not a great name for the class of medications. There's a lot of stigma in that. But you could also call them dopamine blockers. So they decrease the effective level of dopamine in the brain. And they include, usually you use the new generation ones. So things like olanzapine, quetiapine, risperidone, paliperidone. You might be on one of those ones. And there's also clozapine, which is the one you try after a couple of these ones have failed. So the second line, well, it's actually third line, but it's the drug that's the most effective. But since it has so many side effects, you don't try it straight away. And some people are fine on clozapine and have no side effects, by the way. It's just because there's a risk of side effects that you don't try it straight away, because something else might work just as well and have less side effects. So I hope that was helpful, guys. If there's anything I can do if you have any questions or anything like that, please comment below, I'll answer them. If you want me to talk more about some of the medications, then we can do that as well. I'm interested in actually making a video around clozapine. And yeah, if you want to support the channel, the best thing you could do is like the video. I'd really appreciate that. And have an absolutely lovely day. I hope that was helpful, and I'll see you all in the next video. All right, bye for now.